friends, this is Dr. Selva Kumar, diabetologist from Mohan Diabetes Center, East Tambram. Today we know that the escalation problem in diabetes and heart problems in developing countries like India and around globe, the growth of diabetes and heart problems are increasing. So we should know what is diabetes and what is the diabetes causes the complications of diabetes. Diabetes is a vascular and metabolic syndrome characterized by chronic hyperglycemia and changes in the carbohydrate, lipid, protein metabolism due to the defect in the insulin action and insulin defect or both, which leads to the chronic causes in the small vessels and large vessels, that is a microangiopathy and macroangiopathy. So which leads to the complications in the heart, kidney, eyes and nerves. So these are divided into two complications, that is a macrovascular complications of diabetes and microvascular complications of diabetes. Macrovascular complications, especially the heart and the stroke and peripheral vascular disease which occur in the limb. So these are called macrovascular disease. And microvascular disease, due to the long-standing sugar, uncontrolled sugar, chronic hyperglycemia, leads to the small vessel changes in the kidney called retinopathy, and in the kidney it is called nephropathy, and in the nerves it is called neuropathy. So let us look at the cardiovascular problem. We know that the developing countries, especially in India, the diabetes and heart problems are epidemically increasing. That is a twin tsunami occurring in the India and developing countries. So we should know the primary prevention, secondary prevention. So for secondary prevention, before the organs get damaged, we should prevent the secondary complications by curtailing the problems of controlling the ABCD, that is A1C control, blood pressure control, cholesterol control and diet, and E for exercise. All these ABCD the diabetic patients should know very well. And let us look at the cardiovascular problem in a diabetic patients. Heart problems are 2 to 3 to 4-fold may increase compared to the non-diabetic subjects. So heart problem, if you see, there are modifiable factors and non-modifiable factors. Modifiable factors, if you look at the diabetes control, hypertension, cholesterol, smoking, less vegetable intake and stress level. These are the modifiable factors. And the non-modifiable risk factors for heart disease and diabetes: age, family history, ethnicity. These are the modifiable factors and non-modifiable factors for risk of developing heart disease. Hence, one should know the control of hypertension, control of sugar, the control of LDL cholesterol target below 100 for diabetes, and with heart disease should be below 100. 100 is a non-HDL, 70 for HDL, so LDL. So you have to control the cholesterol, and taking statin is must. And if you know the cardiovascular disease, that's why in our center we take in cure study, we have shown that the cardiovascular problems and retinopathy, nephropathy, neuropathy by tune of 17 to 18% of the people develop complications, and that's why we tell them to control all these factors not to develop the complications of diabetes. And if you see, that's why we take every year ECG. ECG is the electrical this one is the the electrical activity of the heart. So if we look at the ECG and see any changes in the ECG, then the patient should subject for the treadmill or echo, depend upon their complaints of the and any other problems like breathlessness or swelling in the foot, and that's why we take the X-ray also once in a year to look at the heart size. So heart problems may vary. So due to diabetes, it can happen cardiovascular disease, heart blockage, or any muscular weakness leads to the failure of the heart. So we detect doing a echo and ECG and treadmill depends upon the patient presentation. So that is very important. So other clinical, non-clinical atherosclerosis list like doing a reactive this one CRP and the calcium score and the carotid medial intimal thickness. These are the endothelial dysfunction early before occurring the atherosclerosis. We will be able to detect, and accordingly we will tell the patient to cut down the control of the sugar, control of pressure, and obesity also play a major role in controlling the cardiovascular disease. And vegetable intake, some of the Indian setup, the vegetable intake and fruits intake have come down considerably. So increasing the vegetable intake and fruits and cutting the saturated fat, they can prevent the heart disease. That's why it is all the secondary prevention is very important in a diabetic patients. So coming to the other macrovascular disease like stroke and peripheral vascular disease. Stroke can also increase 2 to 3 fold in a diabetic patients. Thereby likely all the risk factors are the cardiovascular risk factors are holds good for the this one for the stroke also. So we have to control all the risk factor for preventing the occurrence of the stroke. And peripheral vascular disease, especially in the smokers and diabetes, the occurrence of peripheral vascular disease in a non-diabetic patients comparatively in a diabetic patients are more. So this is a very deadly complications. And apart from that, what we should know is more than 50% of the hospital admissions due to the due to the foot problems. That's why we tell them to go for the yearly once a Doppler study and look at the feet for the any changes in the skin color. So if at all they have, and we have to tell them to take statin and aspirin to prevent the amputations. So in the early stage we can prevent, and even nowadays we do an angiogram and look at the block where it is exactly, so thereby putting a stent or even a bypass, they can save the ischemic limb. That is a very essential. So for early we do a simple Doppler screening test in our center, thereby we can prevent, or even the problems of limb salvage can be addressed easily. So coming to the microvascular disease, the retinopathy is the deadliest complication. One of the vision loss is due to the retinopathy, and this initial stage we can screen them early. Once we tell them to screen the retina, especially the ophthalmologists, they screen the retina and detect the early changes in the eye, thereby, and if you see the early changes like non-proliferative retinopathy or proliferative retinopathy, we have specialized equipments like OCT, and we can be able to see the thickness of the retina, and even if they require, we go ahead and do a FFA. So thereby we can easily identify the leaks in the retinal vessels, and we tell them to go for laser if it requires, and thereby the visual loss visual loss due to the retinopathy can be controlled, thereby they can lead a normal life. And that's why if they develop complications of retinopathy, and every year they have to go for the retinal examination. And the other this microangiopathy is the diabetic nephropathy. Diabetic nephropathy is the microvascular complications where due to the complications on the retina, the nephron, the changes in the basement membrane thickness leads to the leakage of the protein in the kidney, then that leads to the renal failure. So early stage, there are 5 stages in that early stage: stage 1, stage 2, stage 3, normoalbuminuria, hyperfiltration of the nephrons, and again microalbuminuria, stage of macroalbuminuria, then kidney failure. So if you deduct in the microalbuminuria level, so thereby we can control the diabetes giving the AC inhibitor or ARB blood pressure tablets. We can retard the progression of the nephropathy into the late stage kidney failure. So diet control and again sugar control is very important to keep the microalbuminuria under control, or some in the early stage it is also reversible. So coming to the diabetic and neuropathy, that is nerve problems in the foot. So we have already seen that there is a neuropathy and the peripheral vascular disease. Both can occur in the feet. So diabetes should be very controlled. And again, the foot problems, the diabetic patients every day, they present sometimes they present with the positive symptoms and negative symptoms. Positive symptoms like lancinating, excruciating pain and numbness or tingling, or the foot problems in the night more, and the foot problems is more. So again, if you look at the microvascular disease, neuropathy, diabetic neuropathy is the commonest complication we come across in diabetes, and even it can occur in a pre-diabetes also. So every year they should undergo a biotensiometry and tuning fork test and monofilament. So again, in the house, the diabetic patients, they can have a mirror, so they can look at their dorsum of the foot, and so any change in the color, they should definitely look at their Doppler, that is the arterial supply of the limb, and numbness, and again the insensitive feet is common in diabetes. That's why they should not walk in barefoot, and whichever the insole, the microcellular rubber, we advocate for them to wear. Footwear should be properly fitted, and the toe box, when they go for the shoes, the toe box, the front portion of the shoe should be broader enough so that they don't injury the foot inside the footwear when they walk. And the cutting the nail should be the proper manner, and they should not injury the foot when they are cutting the nail. And they should also take care of the diabetic control, very important. And again, vitamin deficiency, and also we have to advocate them for any other changes for neuropathy due to non-diabetic cause also we have to keep in mind when we deal with the neuropathy. And their hemoglobin and alcoholic also can aggravate the neuropathy symptoms. That's why we don't aggregate alcohol intake for the diabetic patients. And so the control of hyperglycemia, keeping the A1C under control, and cholesterol control, and stop smoking and stop alcohol is very important for taking care of the diabetic neuropathy. So we have all good control of diabetes is very important. Dr. Mohan Diabetes in Tampuram Center, we have dedicated team for all the complications to take care, like heart, we have dedicated team, and for taking care of the food, including our podiatric surgeons are available, and retinopathy screening, and definitely in the art of good retinopathy screening every year for this dedicated technicians are available here, and the diabetic retinopathy is also been seen in our center. Sorry. So, thank you. And dedicated dietitians are available to tailor-made the diet for the diabetic patients, and this one we take the history of the patients when what all they take, and according to that whether non-vegetarian, vegetarian, we tailor-made the diet for them. And please, in a diabetic patients, so we know that the diabetic complications prevention is a secondary prevention to not to occur from the diabetic to the complications occurrence. The secondary prevention is very important, so not so that they don't go into the end stage kidney failure and the heart failure. So thank you very much.